Did you know that reflux is not actually caused by too much stomach acid? And while taking antacid medication like Omeprazole can help with your symptoms, it's not actually treating the root cause of the issue.
If your stomach hurts, eat a Tums.
What's the difference?
One is chalk.
Well, I'm not wasting Tums. Tums is very good to draw with.
Even worse, long-term use of antacid medications like Omeprazole have been associated with a whole host of health issues, including stomach cancer, heart disease, chronic kidney disease, pneumonia, small intestinal bacterial overgrowth, or what's known as SIBO, dementia, and bone fractures. And if this isn't bad enough, these medications can also lead to nutrient malabsorption and deficiencies, due to there being a lack of adequate stomach acid to chemically digest your food. So these potential nutrition deficiencies include things like vitamin B12, folate, iron, magnesium, calcium, zinc, copper, and many amino acids. Yikes. So clearly, you don't want to be on antacids for a long period of time if you can help it. But before we get into how to resolve reflux for good, we need to understand what reflux actually is and what causes it. Let's break it down real simply here. Acid reflux, which is technically called gastroesophageal reflux disorder, or GERD, is simply when acid from your stomach refluxes back into your esophagus, the tube that delivers food from your mouth to your stomach. So it's not too much stomach acid that's the problem. It's stomach acid that is in the wrong place that is the problem. And this is what can cause symptoms like heartburn or indigestion, where your stomach just doesn't feel right, or you're burping a lot and you feel uncomfortable. That's what you're dealing with. In the short term, reflux is just uncomfortable, but when you have it for an extended period of time over the course of many years, it will change the cells within your esophagus, and it can lead to a condition called Barrett's esophagus, which is the precursor to esophageal cancer. This is something that you don't want to ignore because survival rates for esophageal cancer are extremely low. But you also don't want to deal with the potential long-term side effects from taking antacids over the course of many years. So the question is, what is causing your stomach contents to reflux into your esophagus, and what can you do about it? Well, the simple answer is something is compromising the integrity of your lower esophageal sphincter. The lower esophageal sphincter is a small flap between your esophagus and your stomach that controls food entering your stomach and also prevents the food from your stomach from refluxing back into your esophagus. When something compromises that function, you get reflux. Now, there are numerous factors that can affect your esophageal sphincter from working properly, including certain foods like fats, coffee, chocolate, mints, sugar, onions, and alcohol. This is why doctors will often recommend avoiding these foods if you are currently dealing with reflux. Medications like theophylline, albuterol, NSAIDs, which are things like Motrin and Advil, calcium channel blockers and beta blockers, which are blood pressure medications, morphine, Valium, barbiturates like phenobarbital, nitroglycerin, and Viagra. Hiatal hernias, which is when a small part of your upper stomach pushes through the muscle that separates your abdomen from your chest. Smoking, which I really believe is a byproduct of the nicotine in tobacco. Pregnancy and obesity. And then finally, anything that increases intra-abdominal pressure, which I think is why pregnancy and obesity will also lead to reflux. Now, there is a growing belief in the functional medicine field that the increase in intra-abdominal pressure is at the root cause of many cases of reflux. The proposed mechanism starts with decreased stomach acid levels, not too high levels, too low stomach acid, which can be a result of things like stress, age, or an infection, to name a few of many. Without adequate stomach acid, intestinal microbes can grow in areas in the gastrointestinal tract where they typically don't, and this is something that's called small intestinal bacterial overgrowth, or SIBO. The issue with decreased acid production is that it impairs the digestion of food and the appropriate release of digestive enzymes. When these bacteria that are in too big of a population in the wrong part of your gastrointestinal tract get these partially digested food particles, they produce an excess of hydrogen or methane gas. This excess production of gas can increase your intra-abdominal pressure, causing food in the stomach to reflux into the esophagus. And this would explain why simple dietary changes are often not enough to fix reflux by itself, because it is not addressing the low stomach acid and the bacterial overgrowth at the root of the issue. And this theory aligns with my clinical experience with my clients. Once I've helped my clients heal their gut, their reflux symptoms improve dramatically. In fact, every client I've worked with this year on reflux has gotten off of Omeprazole completely, and one of them had been on it for over 17 years. But it took a comprehensive approach that went beyond simple dietary changes and taking specific herbal supplements. And I do want to show you exactly how we did this and the specific process involved to get them off of these medications, and we will cover that in the next video. So please subscribe so you don't miss out on that video, and share this with somebody who you think would benefit from this information.